One of the real challenges of interoperability is getting specific clinical information that we can integrate into the workflow.
From a clinical standpoint, obviously, it's very helpful to understand, as patients are very mobile today, where they've been, where do records reside. If I want to treat this patient, how do I get access into the information about them?
We've got these connections across the marketplace, and it allows us to bring actionable intelligence across those connections and deliver it to the points of care where it matters and can make a difference in a decision process. By having almost all of the EHRs, PBMs, pharmacies, clinicians, pharmacists, and bringing health plans, long-term care facilities, specialty pharmacies together in this network, we've really found that we have an opportunity to go further. And we call that the ShareScripts Network Alliance.
Since day one, we have been a convener of stakeholders in healthcare. That's just been part of what we are. When we've proposed standards or standards changes, we do it as a collective. What we've done with e-prescribing and the fact that 13 billion clinically related transactions are flowing on an annual basis, and 5 million scripts daily is, no one's done that. This is true interoperability.
So having a record locator service is very important. Having one that's got a national scope is really important, because no matter where you're located, you're always going to be seeing patients at some point who have records elsewhere in the country. It's just a fact of our modern world.
So for example, being able to send safety information into the physician about a drug-drug interaction, or maybe their patient has seen other physicians who ordered medications that aren't compatible with the drugs that they've had the patient taking. Giving them that information through clinical direct messaging at the point of care can greatly inform decisions that are made at that visit.
So every provider, when they see a patient, takes a medical history from the patient. Depending on how much time you have, that determines how deep you can go. As a primary care physician, I'll sometimes spend up to an hour with somebody. Not every provider has that luxury. Having that information collected, documented in their medical record in a way that's organized so that all care providers can make reference to it, informs the care that everybody receives, and makes sure that the care that the patient receives will be more personalized and appropriate.
I mean, these are all tools that should bring information access to all providers. This is one barrier that if we can break down, it will ultimately reduce the cost of healthcare, at the same time increasing the efficacy and efficiency of healthcare for all patients.